We're living in a time of great change in healthcare. With the implementation of the Affordable Care Act well underway, we are getting more people insured, and huge changes are also on the drawing board in how we deliver care and how we pay for it. Yet, with all of this change, there are no guarantees that we'll realize a high-performing health system that meets the needs of all people, improves health, and is sustainable over the long haul. Instead, reform often devolves to which entrenched interest is going to weather the storm or even improve its own position. Too often, health reform appears to be about money and power and not at all about health and people. At Universal Healthcare Foundation, we are committed to changing this dynamic by making sure that consumers participate actively and meaningfully. Evidence shows that policy and reform outcomes can be improved immensely when informed consumers effectively weigh in early and often, exercising their collective power. But when we look across today's healthcare landscape in Connecticut, we're troubled that consumers are so often not at the key tables, or if they are, they have limited power to shape outcomes. Since the Foundation's beginnings, we've worked to ensure that the voice of the consumer, the patient, the everyday resident of Connecticut is not only heard but acted upon. These more recent examples of changes are transpiring during a time when the Foundation has recommitted itself to amplifying that voice by building better informed and more effective public demand for change. And that brings us to today's program, a morning-long conversation about empowering consumers, strengthening our voice to transform healthcare.